All right, everyone. Welcome to our first presentation webinar series. And I have Aviv Bliwas and Sue Severino with me. I have everyone muted, but if you have any questions, feel free to shoot me an email and I will go through a couple of housekeeping items. We did receive a bunch of questions in advance, but if you have any other ones, if you're using a cell phone, tap your cell phone, and down here at the questions, you can enter a question there. If you're on a unable to do that, my email is broof@roofadvisorygroup or roofadvisory.com. And if you're on a computer, in the top right-hand corner, you'll see that little red arrow. You can pop that out, and down here, the questions, you can submit your question there. I do want to wait a few minutes in case we have some stragglers that are popping on. But I will leave this up so you guys can kind of get a background of who our expert panelists are. We did get a fair amount of questions in advance, so we'll start with those, and I'll keep an eye on any questions filtering in. Maybe I can give a quick background on who our expert presenters are. We have Sue Severino, who is a physician's assistant and registered nurse, and she ultimately founded her company based on experiences with her family. So she does a lot with supporting clients in medical appointments, treatment options, insurance claims, and has a wealth of knowledge regarding that. And Aviv is an elder care attorney, does a lot with making sure that the funding for nursing homes and applying for medical benefits is met for families. And also she started her company based on both of her parents and their elder care issues. And I'm Bryson Roof with Roof Advisor Group, a division of Fort Pitt Capital. I'm an investment advisor and integrate a lot with professionals like Aviv and Sue to help clients navigate various different financial situations, whether it's aging parents, adult children, real estate issues, investment, financial planning. So with that, it's probably a good time to go ahead and get started. So Sue, maybe the first question should go to you about the different levels of care. A lot of people ask, what are the different levels of care, and how do you choose, or how does a nursing home facility choose what level of care is appropriate per individual?
So if we're looking at senior retirement communities, we're looking at a couple different levels. If you're still able to do a lot of things for yourself and take care of yourself pretty well, but you want to move into a retirement community called continuing care retirement communities, this area is one would be Bethany Village, Messiah Village, Green Ridge Village down in Newville. Some of those types of communities have multiple levels of care. So independent living would be, again, you'd move into a cottage or apartment, you're still able to take care of yourself, but you might have the benefits of having restaurants on campus and other things to help you out should you need extra help. You could then move into what's called personal care. Some places have assisted living, but not too many. Most places are now called personal care facilities. And so in personal care, you might need a little help with your medication management. You might need help with bathing, dressing, grooming. Maybe you're having some walking issues, so you might need a little assistance with that, with transfers. If you get past the point where you need more than one person to help you with a transfer to a bed to a chair, or maybe you need a wheelchair full time, maybe you can't walk at all anymore. If you're having more issues with acts of daily living, so you can't bathe yourself, dress yourself, you are having incontinence, then you're going to be more likely needing skilled care or long-term care. the decision making is really based on, you know, how far advanced your care needs are, what your acuity level are. There are some personal care facilities that do take pretty high level people these days, and it's totally different than it was even 10 years ago. So we're seeing some people stay in personal care a lot longer. Again, it just depends on the community you're living in. Some thresholds are lower than others as far as when you advance to skilled care.
Perfect. So obviously the next question that we always get is, how do you pay for it? And Aviv, that's kind of more in your domain. Really, it comes down to probably personal assets versus government benefits versus insurance. Do you want to kind of elaborate on that a little bit?
Yeah, so of course, and they all welcome your cold hard cash. So you can always just pay for it out of your assets. For independent living, you're just kind of looking at like a rental type cost, something comparable to that, maybe a little bit more. Personal care, now you're starting to get up there. You're looking at, on a low end, and I mean really low end, probably $5,000 a month. And I see with my clients more in the realm of $8,000 a month. Depends on your needs. And then skilled care, you are looking at a minimum, and that's for a place none of you want to go, of $10,000 a month in this area, all the way up to the place Sue and I like the most is running between 14 to 15, more like 15,000 per month. So if you do not have enough assets to pay for that indefinitely, if you've got long-term care insurance, great. Sometimes it's not super cost effective. I leave those discussions to Bryson. There are some life insurance policies with riders where if you need them to pay for long-term care, they will. If you don't, they'll pay out as life insurance. So that's just a decision to make with your advisor of whether it makes sense or not to do that. I always like them when I have them, but I realize it doesn't always make sense. The premiums can just be ridiculous. You've got a few different government benefits. If you're a veteran, there's some VA benefits out there that you can access to help. If not, so a lot of people get confused the difference between Medicare and Medicaid. Medicare is not paying for long-term care. It will pay for skilled rehab in a skilled nursing facility after a 3-day hospital stay, up to 100 days per year. Although Sue and I could probably count on one hand how many of our clients have actually gotten all 100 days. Usually they're kicking you off after 20 or so. That's got copays after 20 days. And then there's Medicaid, which is the biggie. So Medicaid is the only government program that pays for long-term care, and it will not cover independent living. It will not cover personal care in this state. Some states it does, not in Pennsylvania. It will cover skilled care in a facility, and it will cover skilled care at home. There's a home area to it with a lot of other rules and regulations. And that will cover 100% of your care, but you have to spend down. There's asset and income limits to it. And you got to kind of know those rules.
Perfect. So a lot of times when you hear about funding for nursing homes or skilled care, the first question I hear is, do I need a family trust? And normally when that conversation comes up, we pull the attorney in, interface with the attorney. But do you need a trust in order to make it into a nursing home?
You don't. And sometimes, just depending, it may hurt you. And Sue and I certainly work really closely together, usually with an advisor, to figure out how best to accomplish things. Because You know, I always say long-term care planning is finding a way to pay for the care that you want. So if you want to be in a nursing home that is the best, and who wouldn't if you have to go to a nursing home, you aren't gonna probably get in if you have no money. Sue and I always have a discussion of, okay, how much money do we need to make available for the nursing home so that we can get our person in, versus how much money can we protect for a spouse or for heirs. Or what a lot of people forget about is for things that make life worth living. Because Medicaid certainly doesn't pay for everything. It pays for the basics, but it doesn't pay, for example, for someone like Sue. Sue's a healthcare advocate. She comes in, she checks in, she's making sure that they're not messing up your meds, that you're getting everything you need. It's an extra set of eyes making sure you have everything you want or need. Medicaid doesn't pay for Sue. And if you are on Medicaid, you don't have any money left, at least that they can see. And so it needs to come from somewhere else. And a trust is one way to protect assets for things like that, so that the nursing home can't demand them, the government can't demand them. But it's also a way to protect assets for spouses. It's also a way to protect assets for heirs. There are other ways to do it though. So it's really on a case-by-case basis. And you just wanna talk to someone like me to see if it makes sense for you.
We just had a question come in, and you had mentioned veteran benefits, and throughout this you had mentioned spouses numerous times. The question is, do spouses qualify for veteran benefits in a nursing home or skilled care situation?
So they only qualify if the veteran themselves is deceased. So there are surviving spouse benefits.
But not living.
Not if the veteran is still alive, the spouse isn't entitled to benefits themselves. It could affect what the veteran is entitled to if they have extra medical costs for a spouse. So again, case by case basis, but generally no, only if the veteran is dead.
Okay. While we're on spouses, let's talk a little bit about, should a married couple add a child to a checking account or sign over a house to children to protect from the nursing home?
The answer is almost always no. It certainly depends on your goals, and again, case by case basis, absolutely. But there's a lot of consequences that you need to think about before you do it. So first of all, you sign anything over to a kid, well, now they are either the sole owner or the part owner, and they could take it. I'm going to assume all of you guys trust your kids. So even if you're not concerned about that, if they end up getting divorced, could potentially be subject to a divorce action. If they get in a car accident, it could be subject to some sort of lawsuit. And if they die before you do, and it happens more than you would like, now you're getting your own assets back, subject to inheritance tax. So those are some major consequences to doing that. The other big one, particularly with a house, is capital gains tax issues. Pennsylvania has a 4.5% inheritance tax from parents to children. And that's on every dollar. They want that penny of tax or what have you. There's no exception like in the federal rules. And if you are given a house, you are getting it at what's called the basis, the value of whatever the person who gave it to you bought it for. So a lot of my clients bought their houses and they've lived there forever, and they paid $50,000 for that house, and now it's worth $200,000. You're gonna pay a 15% capital gains tax. Is that right, Bryson? 15, 20%?
15 or 20, depending on income thresholds.
Depending on some other things. But even 15, we'll just take the lowest. You're going to pay 15% on the difference that it has gone $150,000 exactly, as opposed to 4.5% on 200,000 at the time of death. And I don't even have a calculator, but I am positive that you're actually paying more tax in the end with the capital gains from being gifted than you would if you just inherited it. So those are the reasons you definitely want to think twice about it. I won't say I never do it, but you always want to talk it through.
You've trained me well over the years, Aviv. When clients ask that, I say, I'm not an attorney, but let's think through some of the pros and cons of it. And once we outline what the objectives are and the costs and include the attorney and get everything involved, I've very rarely seen it make sense to sign over a house for creditor protection, for costs, for taxes as you outlined. So
yeah, very rarely.
What about a checking account? You know, a lot of clients say, hey, my mom's getting sick. It's just easier if I get put on the checking account and I can write the checks for mom, or I can write the checks for dad. He has dementia. He doesn't remember to pay the bills.
Mm-hmm. Yeah, so again, you're looking at those same risks. I'm less worried about capital gains with a checking account, obviously, but I'm not worried about it at all. But you are running that risk of child dies first, you're getting your own money back subject to inheritance tax. What if the child just takes the money? What if the child ends up in long-term care? Now it's an asset of the child's that can be taken. I've had that happen. Divorces, all those things. And there's a really easy solution if it's just about making sure you can pay the bills. It's better to just put a power of attorney on file. You have all those powers to write checks, to pay bills, to check on the balance, to close the account, to open the account, whatever you want to do without any of the liability. So I always prefer clients go that way.
And power of attorney is not expensive. We tend to recommend that. You've trained us well on that as well.
Well, and you don't, I mean, I love a power of attorney. I think it's actually the most important document anyone can do. I certainly have one. Bryson, do you have a power of attorney?
I do.
Bryson knows what's up. But if you don't want to pay a lawyer, and I think I charge like $200 or something for a power of attorney, the banks have power of attorney forms. And I know Bryson people have this. Where they just have their own form and it just applies to that account. You can't take it to the bank across the street and use it there. But if you don't want to use an attorney, you can just tell the bank, hey, I want to authorize someone on this account. What's the form I need? And that's free.
Right. And a lot of brokerage companies have that. So a Charles Schwab, a Fidelity, they have those forms available as well. Now, Sue, with everything going on with COVID, we have clients whose aging parents have dementia, Parkinson's, and they're in situations where they are looking at changing skilled level of care, or they're looking at changing facilities based on a specific set of parameters that maybe this facility does a better job with memory impairment, or this facility focuses on Parkinson's. How do you go about transitioning aging parents or clients to different levels or different facilities with the current pandemic?
So again, if you're in a continuing care retirement community, it's not as big of a deal. So if you happen to be in personal care or independent living and you're getting worse and you need a higher level, you're going to be able to transition within your community. However, if you're, in a home situation and you now need a nursing home because you've gotten drastically worse and your family can no longer take care of you, it is going to be a big challenge. It's going to be harder to get anybody in a facility because that facility is trying to keep themselves safe and keep their residents safe. That's their priority. There are many facilities in this area that have had large numbers of COVID cases. Obviously, their doors are closed, and the people that have had no COVID cases, their doors are closed as well because they want to keep it that way. And maybe as we go through the summer months and we do have more testing and we have facilities that stay with perfect records, that they will eventually come up with plans. There are some plans put in place by the Department of Health to recommend what we do to have the facilities open up. That's a big issue for visitation. People can't visit their loved ones, and it's very distressing. We're having more and more residents that are declining because of lack of social stimulation and not seeing their families. But those things are going to take a while. We're still not in the green zone anywhere around here, and nursing homes are going to lag behind significantly. We have such a vulnerable population, and if you look at the number of deaths over this time period in nursing homes, both residents and staff members, it's astonishing. There's over 25,000 deaths just of patients alone, and a number of 450 is what I read yesterday of staff members that have died of COVID. So it's a very vulnerable situation. We're not prepared to have their doors just suddenly open. But if you are faced with trying to get your loved one in a facility, I think the best thing you do right now is get applications in, get yourself ready to go. And when their doors are open, hopefully their admission coordinators can help you and transition. We probably will get it to a point where people will be able to be put into a restricted area of that facility under a 14-day quarantine, be tested before they enter that facility, and hope for the best. But again, it's really touch and go for quite a while, and I think even throughout the rest of this calendar year, we're going to have a hard time transitioning people. And so the goal is really going to be, how do we age in place and do a better job with that?
Yeah, it's a very challenging time, a very unprecedented time. Aviv, another question we get frequently is, what happens if we had assets and we used all of our assets on nursing home, skilled care, assisted living? What are our options?
So then you are definitely just going on Medicaid. I mean, that's what Medicaid is for, is when you run out of money. I will say, if you're in a CCRC like Sue was talking about, like if you're not in skilled care, you don't need that level yet. A lot of the appeal of something like a CCRC is they often will say, okay, you're going to give us all your money, but we'll keep you when you run out, no matter what. But if you aren't in that situation, Medicaid will pay for skilled nursing. If you are in personal care, I don't know what you do. You get Sue and you try to get eligible for skilled nursing because there really isn't anything. So when you're down, and spouses get to keep up to 1/2 of the assets, or right now it's $129,000, whichever amount is less. They also get to keep all of their income, and they get to keep their retirement accounts. That's completely exempt from that $129,000. They get to keep their house, they get to keep a car. Also, there's a few other things, a little bit of life insurance. If everything else is gone, the nursing home can help you apply for Medicaid. Their business offices do it. And then Medicaid will kick in and just start paying. You'll turn all your income over. The sick person's income will have to go towards their cost of care, but they won't be responsible for any more room and board or any of other expenditures at the nursing home.
So when you say income, you're talking pensions, Social Security, that type of income, correct?
Yes, I'm talking pension and Social Security. If you're on Medicaid, you don't have your IRAs anymore. Those are not exempt. So you aren't getting RMDs anymore. So don't worry about that. And you won't have investment income anymore because, again, you won't have anything if you're eligible for Medicaid. So that doesn't count. Just those monthly recurring income streams, whatever those are.
Now, with the recent updates to the CARES Act because of COVID-19, clients are not required to take required minimum distributions. So that is one thing that's kind of in flux. We don't know how nursing homes and eligibility will result from that. I know from an IRS standpoint that clients do not have to take those RMDs, and we've talked with clients about whether or not it makes sense to take RMDs. So that's something that we've been coordinating with elder care attorneys to say, do you need to take it? Do you not need to take it? And how is that going to impact your eligibility? We did get a follow-up, Aviv, about when would it make sense to have someone registered on assets such as a home or a checking account. We kind of covered when it doesn't.
So if you are not worried about whoever you're adding on, if you're not worried about them taking off with it, if you're not worried about a divorce and you're not worried about a lawsuit, and there are always risks, but some people are just like, it's pretty low risk, I'm willing to take it. On a house situation, I have had it make a dollars and cents make sense when it was a fairly new purchase, and so the house had not appreciated very much in value, or in fact it had depreciated in value. So then you probably are going to come out ahead on tax savings, because as long as you live a year past when you make that transfer, whoever you have transferred it to is not going to pay inheritance tax. And when they sell it, it will probably not be very much capital gains tax, if any. So that can sometimes make sense. If your sole beneficiaries are not children, if they are nieces and nephews, for example, nieces and nephews have a different tax rate. You actually pay 15% state inheritance tax to go to them. So now you got a capital gains tax of possibly 15% with an inheritance tax of possibly 15%. So now it might make more sense. That's one reason. Tax savings sometimes. So if you add someone on to liquid accounts, but you're still on them, now they are only paying half the inheritance tax instead of the full amount. So they pay if it's a child, 4.5% on 1/2 of the value of the account. So sometimes my clients love, we all love paying less taxes. So sometimes that's the more important goal to them, is just pay as little as possible. I can't think of any other instances off the top of my head. I'm sure there are more, but it is definitely, every client is different, everyone's situation is different. And so that's why it's never a good idea to like take advice from your neighbor about what they did, because everyone's situation is different.
And I would say that holds true not just for estate planning and elder care planning, but Sue, obviously with health, what works for one person may not work for the other. And obviously with financial planning, it's so independent and circumstantial. Had a question come in, and it's kind of a two-phase question, likely both of you. But Sue, let's start with you. What are the recommendations for aging in place, especially when they might be at or close to skilled care nursing stage?
So the big problem with aging in place is, can you afford it, and do you have the help to do it? So the affordability tends to be the reason why a lot of people end up in skilled nursing under Medicaid. If you're looking at around-the-clock care, you could pay up to $500 a day to have help in your house. If you're looking at $25 an hour, you know, it's well over $500 a day to be in your house, where a nursing home is $400 a day, approximately. So finances are a big reason why, you know, it's hard to age in place. But if you don't have an option, then, you know, you're in a position where you have to find family members that are willing to stay with you, care for you. It tends to fall on the adult children, particularly the daughters of those family members. If we look at caregiving across the U.S., majority of it's done by women in their families. So do you have a daughter that lives nearby? So, you know, if you're going to have children, make sure you have a couple daughters, because they're more likely to take care of you. So, you know, what I'm looking at with aging in place, I think that's really where we're going to have to move in the next, you know, couple years because of COVID. People are afraid to put their family members in facilities because they don't know when they're going to see them again. I have a 89-year-old mom who we have at home with full-time caregivers, and the reason we're doing that is because I just can't bear the thought of her going somewhere yet. And I know that if I put her in a facility, it's likely that I won't see her again until she, you know, until it's a day before she dies. The only way people are getting in nursing homes for visitation right now is through Skype, FaceTime, looking through the window if they happen to have a first floor room. If you live in a multi-story nursing home, you're not going to see your loved one on the 5th floor unless you're using some sort of technology. So for those people who can't face the fact that they're not going to see mom and dad again for a long time, should they go in a nursing home in the next 6 months, we've got to come up with ways that we can keep them at home. And whether they move in with an adult child, if they have the finances. And again, I think anything you're dealing with long-term care, whether it's Aviv or me, it all comes down to planning with you, Bryson, and coming up with a financial plan. How do we make this work? None of us think we're gonna get old and need care, but the bottom line is we're all gonna get to that point someday. We're gonna need some level of care. We have to figure out how we're gonna afford that care when we're in our 50s, not when we're 85. It's too late then at that point. So, you know, we can hire caregivers in the home. It's harder to get 24/7 care because you always have to have a backup plan. Even for my own mom, there's days when an aide would call in sick and my sister and I are having to go over there and be with her. My sister and I both provide care during the week to take some of the expense away. So you have to have a plan in place. It can be done. It's not impossible. It's just a matter of working with someone that knows how to do it, knows the agencies to call, and knows how to put a plan in place for us to figure out if we can afford it. And again, sometimes I'll have to go through Aviv and say, listen, we need to set up Medicaid at home. And there are waiver programs that you can get 24-hour paid caregiving in the home. It takes a lot of work. It takes 6 months or longer to get it approved. But if the family could hang in until we got the approval, we could be able to get paid caregivers in the house and never go to a nursing home.
And what's the easiest way to get that? Is that to do the research on your own? Are there services available to find those caregivers? How do you go about doing that?
Well, you know, in my case, I help people, you know, with that information and help them come up with a plan and solutions. That's pretty much my role with my business is how do you take care of mom and dad, and how do you manage all the different aspects of taking care of mom and dad? Certainly there are some places out there that help, that are competitors of mine, but I can't say that I always support the way they do things. There are places you can call that are listed as free help. Nothing in this world is free. So
yeah, what you pay for.
And you know that if you're calling a phone number to get help for mom and dad and figure out a place to put them, you very well may end up getting the places that they are supported by. So for instance, there are facilities that have personal care homes in this area that are willing to pay 1 month's rent to an agency to provide referrals. And not everybody participates with those agencies. So you may not be getting the top personal care facility in your area. You may just be getting one that's willing to give up money so that they get more referrals. So I always worry, you know, I mean, you don't want to just pick up the phone and you know, call stuff that you see on the TV, radio, that's in the newspaper listed every day and think if it's free, it's not free. It's in the long run, someone's paying money to get that service, and they may not place you in the proper location. So it's very important to do your homework to get adequate help, to make sure that you know where are the right places to go. What you hate to hear is that people go from a hospital to a rehab facility / nursing home. They go there because they have available beds, and then they regret where they've been placed. And some of the biggest COVID outbreaks in this area have happened because they are in a facility that has not been working well for many, many years. And if they have empty beds, a lot of empty beds, it's because they're not a really good facility.
Probably a good indicator of that.
The best facilities in this area have rare open, you know, direct door, let's go right in. If you need a room, I call a place, they say, oh yeah, we have a place, we have space. If they have space, they're probably not a top-notch facility. And you can go on Medicare.gov and look at facilities and see how they're rated, see what kind of issues they may or may not be having. Sometimes there's silly little things that they're dinged for. Their mayonnaise jars are expired or something stupid that they have to get called out on. But we do have some top-notch facilities in this area, and in central Pennsylvania we have some great facilities. Unfortunately, again, some of those facilities still were impacted by COVID, particularly in the Lancaster region, not so much in Dauphin, Cumberland County, but we are having facilities do fantastic jobs in this area, and some of the facilities that have done fantastic jobs are not ones you would think would be doing fantastic jobs, just by the nature of the type of payer that comes into their facility. But they weren't prepared for this. The country wasn't prepared for this. We don't have leadership to help these nursing homes, and it just takes one vector, one staff member that comes in with COVID that's asymptomatic that can turn your nursing home into a nightmare. So they're really working hard, and I do have a lot of empathy for the people who are willing every day to go into their nursing homes and actually work and do this really hard work under these extreme circumstances.
It's definitely a unique time, a very interesting challenge, and that's why the three of us like to coordinate and try and help clients. There was a question that came in, and every industry has its own acronyms and vernacular and jargon. So CCR stands for Continuing Care Retirement Community, and the three of us or our counterparts will often work with clients to do some financial modeling and projections. It's not a one-dimensional equation where a client can come to us, tell us, how do we pay for in-home care, or how do we private pay for this facility? We have to get the feedback from the attorney, from the health advisor, to figure out what type of care is needed, what that cost is going to be, and then we can develop what type of funding we're going to use, whether it's all personal care, or a lot of times Aviv will get involved to re-register accounts. Maybe a joint account needs to be transitioned to a single ownership, And there's look back periods, that 5-year look back period. Maybe Aviv, you can expand on that in a second, that there's some pre-planning done because clients are starting to show symptoms of Alzheimer's or Parkinson's that are longer term care issues. So that, again, that's going to be very personal on how we fund those types of situations. If you maybe talk a little bit about those look back periods.
I know, I was thinking about that earlier. How could I have forgotten to bring that up as a reason why you might not want to transfer assets? Yeah, so you might have heard about this whole 5-year look back thing. So that means that if you need the government to pay for your care through Medicaid, when you do that, at the time you apply, they are going to, and they request bank statements and they request tax statements. So they will find it. Don't think they won't.
I've sent all the statements.
Yes. They will look back at your most recent 5 years and they ask for monthly bank statements. So they are going to look and see if you gave away any money in that last 5 years or any assets. And giving away means transferring for less than fair market value. So selling your house to your kid for $1 is still giving something away. That's not a sale. Transferring into a trust is actually a transfer for less than fair market value. So that's a gift. Adding a child's name to a bank account is a gift. It's debatable what the value of that gift is, but simply adding a name will trigger this. And so if you have a gift within the last 5 years, what the government will say is, okay, are you otherwise eligible for services? Meaning you are medically eligible, and that's a thing Sue sometimes helps me with, but they have to evaluate and make sure that, yes, you need skilled level care based on your medical conditions. And are you financially eligible? And I briefly talked about what that is, but basically you have to be out of money. And only when those two requirements are met will they say, okay, you're eligible for us to start paying for care. However, you gave away money 4 years ago, and for changes every year. So right now it's something like $10,700, I think. So for every $10,700 you give away, we are going to say that you have to private pay for your care for 1 month. And remember, you have no money anymore. So this is like the crux of what I do, is figuring out how do we kind of give assets away while still somehow having money for care. And the whole stick to that is that, because you might be thinking, well, I'm already in the nursing home, and so what are they going to do if I can't pay them? Well, they're going to sue your family. We have laws in our state that say that they can do that, and they will win. So it's just nothing you want to mess with without an attorney involved. So that's the look back.
Well, we always tell clients that the biggest gift you can give to your children is to make sure that you're taken care of. And a lot of times clients want to try and get as much money into their children's hands when one of the spouses is going through a health issue. And, obviously that's when it's important to bring in an elder care attorney, a health advocate, to really outline what the scenario is. But we tend not to give all the money to the children because of that 5-year look back, because of what you just outlined. So looking through some of the other questions that came in, I think we've pretty much addressed everything. Sue, is there anything that you want to have as a key takeaway to this webinar?
Well, I just wanted to let people know that I think, as far as even just looking at COVID and COVID cases, certainly the state of Pennsylvania, the case levels are decreasing. We're still having some outbreaks in nursing home facilities, which is keeping the hospitals busy. However, what I'm more concerned about is to make sure that people are still protecting themselves, that they're still using good hand hygiene, wearing masks when they go out in public, limiting the amount of time they're spending out in public, and particularly in enclosed places. And not just thinking that because we go green that you can do whatever you want. We're still in a risky situation, particularly because Memorial Day and the people who were celebrating during that 4-day weekend, now the people who are protesting. I'm worried for the protesters, particularly because they are getting sprayed with pepper spray, with tear gas. It's making them cough more. If they were asymptomatic carriers, they're more likely to pass that on to other people that were with them. So I think June's going to be an interesting month in the next 14 days, 21 days to see what the numbers look like, particularly now that we're in yellow and some of the northern counties are in green, as to where we go with the number of caseload. I follow some of the local hospitals to figure out how they're doing, and they're certainly not at capacity everywhere, but they are in flux. The numbers had gone down before Memorial Day, and now they're starting to rise a little bit again. So people just need to be prudent with what they're doing, and to continue to wash your hands, don't touch your face, have hand sanitizer with you everywhere you go, wear your mask. We're not going to be visiting nursing homes anytime soon. And this will get better. It's just a matter of us all being patient and doing our jobs to protect ourselves and protect the people we care about.
And protecting our more elder
Population.
parents and grandparents, and keeping our social distancing that way.
Right.
Any major takeaways from today's event that you would like, or the key takeaway that you would like for our attendees today?
I guess mine is just, I said to Bryson and Sue when we first started talking about this, I said, guys, like, I talk about this stuff by myself for 2 hours normally. So don't think you got all the information you possibly could need from this 1 hour. I myself do a free workshop on exactly all the questions you guys were asking about every month. I haven't done it lately because it's usually in person, but generally we run them every month, so you can check my website, or Bryson knows how to get a hold of me for when we're doing our next one. We did a virtual one, we may do another one. And even then we do a free one-on-one with people to go over their specifics. And it is definitely a collective effort when you've got complicated medical issues going on. I pretty much never do a plan without talking to Bryson and without talking to Sue, because you need to get all the information. So don't just think if you're talking to one professional, like your real estate attorney, that they've got all the answers, because it's really constantly information from different areas that I know nothing about. So that's what I want you to take away.
And I would say that's accurate. A lot of times, and we haven't talked about this specifically, but we do loop in the accountants in this process. We loop in family members. So it is a very collaborative approach, and it's, again, very, very circumstantial. And Aviv, I think the biggest competitor you have is not other attorneys, rather it's information that's posted online, it's neighbors, and that's not the source of information you want for these very complex, very individualized approaches. So if you have any questions, don't hesitate to reach out to any of us. Our contact information has been up on the screen, and don't hesitate to call me, Aviv, Sue, and we can start the conversation of what's occurring. And Aviv, I did just get one more last question that came in. I think this is a great one for you. When's it appropriate to consult with a elder law attorney?
Never too early. I have clients in their 40s. I have clients in their 50s. Now, I might not have them doing anything quite yet, but we talk over what the situation is, what their fears are, and we decide, do we need to do anything now, or are we just going to monitor this situation? And I'm going to tell you, when this happens, tell me and come back and see me. I have clients I see every year, and we just go over everything and any changes. And I know what I'm looking for. I know what are triggers that this changes things. And you don't always know what are triggers to me and what I know is coming down the road. So it's never too early. However, that being said, I don't have a lot of clients in their 20s or 30s that need to talk about elder law issues. Depends on your health also. If you have poor health or a family history of poor health, you come in sooner.
And certainly you can do their wills, power of attorneys, and those important documents that everybody needs.
Yeah, you should have a power of attorney when you're 18. Financial power of attorney, I think. That's the most important document.
I would agree, and a lot of times someone can be in their 30s and have parents that are in situations where they need assistance. So just age alone doesn't mean that they can't consult with you. I did have another clarifying question to come out about the 5-year look back period. If there's no 5-year look back issues, can facilities come after children?
No, so the rule is if there is an unpaid medical bill, that medical provider can sue spouses or children for that medical bill. Now that's technically any medical bill, hospital, doctor. However, I have yet to see a hospital or doctor sue a family over an unpaid bill. What I do see, and there are ones that are really known for it around here, but they all can, is nursing home bill. Because if you have a $14,000 a month bill, that adds up really quickly. So that's an unpaid bill. When you have spent down all your money legitimately on the nursing home or whatever, you can buy a car with your money as long as it's a fair market value purchase. It doesn't all have to go on the nursing home. You're still allowed to buy things. You're just not allowed to give it away. Then it's the facility's responsibility to apply for Medicaid for you. You don't have an unpaid bill because Medicaid's paying your bill. So it's only when it's unpaid, and the only way those things happen is either someone's refusing to pay, or you have a penalty period that you didn't plan ahead for, and now we have no money, and we have no way to pay for that penalty period.
Perfect. And nursing homes can't come after children outside of the look back period. Their income doesn't get included. So if you have
children are not responsible to pay for a nursing home cost. You should always honestly talk to a lawyer when you're signing an admission agreement, just to look over it and sometimes explain it to you. There's no obligation to pay for that. There is a law that says a medical provider can sue you for an unpaid bill. They have to sue you. They have to go to court. They have to hire lawyers. Depending on the size of the bill, sometimes they won't even do that. If you didn't do anything and your parent just screwed the pooch, you didn't receive any of that money, just something goofy happened, you could still get sued. However, would a judge find that you needed to be responsible to pay for that nursing home? Probably not. I've never heard of such a thing. Usually where children get found liable is where they were the recipients of the gift,
Right.
or they were taking advantage of their parents or grandparents or whoever and stole some money. That's where it's really coming into play. I don't want you to worry too much about it.
Right. Right.
But I don't want you going around thinking, oh my God, my kids are going to be liable for things. But what I always tell my clients is if you have a concern about a particular transaction, just call and ask the question. And I'll tell you, you're fine. Don't worry about it.
Right. Yeah, that was very surprising to me 4 or 5 years ago when you told me that. But you said, look, I mean, it's what judge is going to find that as a liability? So, and numerous other attorneys have confirmed that as well. So, on a national level, as you've pointed out. So, I do want to let everyone know that if you want to, you can download this contact information in our handouts. If you have trouble getting it, I'm more than happy to email it out, or Miranda, our marketing specialist, will be more than glad to get it out to you as well. I'm sorry I said specialist, but director. So with that, it looks like we answered all of the questions that have been coming in. And if you have any other follow-ups, the three of us would be more than happy to field any questions directly. Our contact information is here. And I'm very appreciative of you guys being our first guests on our webinar series, and look forward to speaking with everyone.
Thanks, everyone.
How do I end the meeting is the question. I will see everyone later.
Thank you. Bye-bye.
Bye-bye.